In this video, here's what we'll cover: why more adults are seeking a diagnosis, what the national guideline is, the 3 stages of assessment, why assessing adults is different, what changes after a diagnosis. There is a particular moment many adults describe after an autism assessment. It is not shock, it is recognition, a quiet sense that a lifetime of small confusions suddenly line up. Why social situations were so tiring, why change felt harder for them than for everyone around them, why a bright, capable person could struggle with things that seemed effortless for others. If any of that sounds familiar, I want to be clear from the start. Autism is a lifelong neurodevelopmental difference in how a person communicates, relates and processes the world. It is not an illness to be cured, and it does not appear in adulthood. It has always been there. What often changes in adulthood is understanding, and in Australia, the way that understanding is reached is now guided by a single, national framework. Let me start with why more adults are seeking answers. The number of Australians identified as autistic is rising quickly. In the Australian Bureau of Statistics survey from 2022, there were roughly 290,000 autistic Australians, just over 1 in every 100 people. That was a rise of more than 40% in only 4 years. Look closer and something important appears. Only about 3 in every 1,000 adults aged 25 and over were identified as autistic, compared with around 3 in every 100 people under 25. Autism does not fade with age, so that gap does not mean older adults are less autistic. It means many were never identified as children. The criteria of the time is them, or they learned to hide their traits well enough to pass through school and work unnoticed. Researchers have called this the lost generation of autistic adults, and a clearer pathway is now helping them find answers. So what is that pathway? Before 2018, autism assessment in Australia varied widely from clinic to clinic. 2 people with similar presentations could receive different outcomes depending on who they saw. The national guideline for the assessment and diagnosis of autism changed that. It was developed by Autism CRC, first released in 2018 and updated to a second edition in 2023. Its recommendations are approved by the National Health and Medical Research Council, and it was built from research, clinical practice, and the views of autistic people and their families. It was Australia's first unified approach, and it applies to adults and children alike. The aim is simple: whoever you are and wherever you live, the process should be consistent, thorough and respectful. The guideline sets out 3 broad stages. The first is referral. It usually begins with a referral, most often from a GP, to a practitioner experienced in autism assessment, such as a clinical psychologist or a psychiatrist. Some adults reach an assessment through self-referral, contacting a suitable practitioner directly. The second stage is a comprehensive needs assessment. This looks at how you're functioning across daily life, communication, relationships, work or study, independence, mental and physical health. It identifies where support might help, whether or not a formal diagnosis is ever made. For adults, this often surfaces the reasons they sought help in the first place: exhaustion after socializing, difficulty with change, sensory sensitivities, or long-standing anxiety. The third stage is a diagnostic evaluation, which answers a specific question: does the person meet the recognized criteria for autism? In the 2023 update, the guideline renamed the older single clinician pathway to the lead practitioner diagnostic evaluation. The wording is deliberate. One qualified practitioner leads the process, but draws on all relevant sources rather than deciding alone. Most of us assess against the criteria in the DSM, which describes autism through 2 core areas: differences in social communication and interaction, and restricted or repetitive behaviors and interests. These need to have been present from early development and to cause meaningful impact on everyday life. A careful evaluation combines several strands: a structured interview, standardized questionnaires, a developmental history, and sometimes direct observation using a tool like the ADOS. No single test diagnoses autism. It is the pattern across all of these that counts. Now, why is assessing an adult different? Developmental history is harder to reach. Someone in their 40s may have no one left who remembers their early childhood in detail, so I work with what is available: old school reports, their own memories, or a conversation with a parent where possible. Masking also changes the picture. Many adults, especially women, have spent decades camouflaging, copying others and suppressing natural responses to fit in. That is exhausting, and it can hide traits from an untrained observer. So I look underneath the mask rather than being reassured by a polished surface. And self-understanding is central. Adults can describe their inner experience in a way young children cannot, and that first-person account is valuable evidence. Finally, what changes after a diagnosis? It is not an end point. For many adults, it is the beginning of a more workable relationship with themselves, as a recognized profile can quiet years of unfair self-criticism. It can support reasonable adjustments at work or study, and where anxiety, depression or burnout are part of the picture, evidence-based therapy can be tailored to how the person actually thinks and feels. A diagnosis can also, in some situations, support access to the NDIS. If you are an adult in Sydney's Hills District wondering whether autism explains your experience, you do not have to work it out alone. At Potentialz Unlimited in Bella Vista, a good first step is simply a conversation. You can read the full guide, or book an appointment, using the links below. Before you go, here's a quick recap of what we covered: why more adults are seeking a diagnosis, what the national guideline is, the 3 stages of assessment, why assessing adults is different, what changes after a diagnosis,